Hi everybody, I hope you guys had a nice weekend. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Let's discuss why you have pinching pain in your knee. So pinching pain in the knee can come on either the inside or on the outside of the knee. It's more common on the inside of the knee, and it can be a very sharp pain, it can be a pinching pain, but it'll stop you in your tracks. And sometimes it can stop you in your tracks and go away. Sometimes it can stop you in your tracks and not let you walk for a couple minutes. Sometimes it will stop you and go away, but there'll still be residual pain. And sometimes you'll see it come over and over again more frequently. So let's talk about why this happens. There's a couple of different reasons. The first is there's a possible tear in the meniscus. The meniscus is just a padding in between the bones of your leg, and there could be a tear in there, which is common if you've played sports, wear and tear over time. Nothing really traumatic has to happen in order for that meniscus tear to occur. So it's not uncommon if you haven't really felt any or had an accident or fell for you to develop that meniscus tear over time. It is also associated with a trauma. So if you have an ACL tear or if you wind up getting having some type of fall, you can tear that meniscus. So a lot of times when you feel that pinching pain, it can be that meniscus, it can be that irritation. So depending on how big the tear is, where the tear is, will depend on whether you need surgery. So it is something that you want to make sure you address, because if you're able to address it, you may not require surgery. So unfortunately ignoring it or hoping it will go away doesn't always work. You need to make sure that you are treating it as needed, which is generally a course of physical therapy, and we always offer free consultations. All you have to do is call our office at 215-997-9898 to get in. Another reason that you could get that pinching pain is a ligament can actually be stuck or caught in that knee. And what happens is, as you get older, you get your ligaments wind up getting looser, your knee winds up getting looser, and as you're moving, as you're walking, some of those structures could get caught. Now this is a typical type of pain that you're going to feel real quick, and then it's going to go away. So if you feel residual pain, if it goes away but still is lingering, if you find it reoccurring, this is not usually what it is. This is a one-off. This is a pretty sharp pain, goes away pretty quickly, never really hear from it again. Something happened, you twisted it, it just got caught somehow, but that will send some pretty sharp pain signals into your brain, and that is where that comes from. It could also be some type of wearing away of the back of your kneecap. So sometimes when you go up and down the steps, you can get these sharp pains or these pinching pains, and that can be this wearing away of the underneath of your kneecap, starting to have that bone-on-bone rubbing. Or it could be your kneecap, which is also called your patella, isn't tracking correctly. So it could be that it's not moving where it needs to be, up and down. And as you go down those steps or go up those steps or bend your knee, you get this sharp pain, either right in the knee or below the knee. That is another reason for that type of pain. And what you can do for that is actually, you do need to address that. It is something that you do need to have physical therapy for. It will consist of exercises, it will consist of hands-on, depending on exactly why that kneecap is causing you that pain, will depend on which direction it needs to go. But it's something that you don't want to ignore, again, because if you ignore it, it's most certainly going to lead to surgery. If you treat it early enough, there won't be any surgery necessary. So just 3 quick reasons why you can have that sharp pain. But anytime you have any sharp pain and it doesn't go away right away, or you feel it constantly, or you feel residual pain from it, it's something that's not going to go away on its own. And it's something that if you ignore it, it's going to get worse and worse. If you or someone you know is suffering with knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.